Okay, so today we're going to do drawing up a solution from a bottle, and so we'll just draw our attention over here. I'm not wearing gloves because I'm not dealing with patients. I have two ways of opening this package, okay? If you really want it to be sterile, you take great pains to peel it open, it doesn't touch anything, and it drops, okay? But I need speed, okay? Clean is usually enough, in which case you can't open it on the plastic side, but if you put it on the paper side, it opens right up and you can take it out, and it's much quicker if I have to start fumbling with this versus just I'm out. So that's much quicker. You have two types of syringes, non-lure locked and a lure locked syringe. The non-lure locked syringe doesn't have anything to screw it on, so if you have some high pressure thing that you're doing, you're going to be pushing, and sometimes this pops off and everything spritzes everywhere. Whereas the lure locked syringe, it screws on, and so this needle isn't going to come off. Okay, so let's start reading.
Okay. So a 21 gauge or 25 gauge needle will allow for rapid uptake from the bottle. Using a 19 gauge needle creates a large defect in the stopper and could theoretically compromise the sterility of the vial contents.
Okay, so let's just look here. You see how large? Can you zoom in and see kind of how large the bore is of the 19 gauge relative to the bore of the 25 gauge? Can you see that? Okay, I mean, you know, to the point where I think you can fit one into the other even, right? Okay, so you can imagine, I'm going to just clean the top off of this one. Get that back in here. Just you know, we're sacrificing this bottle, but inside the contents of here is supposed to be sterile. And of course that's why we clean the top of the bottle. But you know, you make this large hole in the rubber. You see that large hole in the rubber stopper? And of course it's easy to draw the water in and out, and that's all well and good, but you can kind of see right here where we've punctured. And I'll do it again. And when I take it out, again, you can see here where we've punctured, and so we want to try to avoid using such a large gauge needle if we can. Okay, so continue reading.
So use an alcohol swab to clean the top of the solution bottle. This avoids introducing bacteria into the sterile bottle contents.
Okay, so we did that.
So examine the bottle label for A. Contents and concentration, B. Expiration date, C. Requirement of shaking if the material is a suspension such as triamcinolone.
Okay, so here we see it's you know, normal saline sodium chloride. It expires March 2010, and today is June 15th, 2009. It doesn't need any shaking. Whereas if you have a solution like the catalog, this expires November 2010, so that's fine. But you see the bottom of this? It's all the material that should be in a suspension, okay? And so what I do is I have to shake. Now if I shake just a little bit, you still see there's material on the bottom. And so that's not shaken enough. I have to shake more. And you shake more. And if you let your wrist go relaxed, it's pretty easy. Some people shake with their elbow, but I find that if you let your wrist be loose, it's much easier. And now you have it all in suspension, and this will last in suspension for a little bit of time, you know, about like two minutes, but after like 2 or 3 minutes it does start settling down again. Okay?
Okay. So uncap the needle and draw up the amount of air equivalent to the amount of the solution desired.
Okay, so I have to, let me just use a fresh needle here. So we're uncapping. This is a 25 gauge needle, and we'll just squirt this out here. Okay, so we put the needle on, we uncap the needle, and let's say I want a half a cc or 1 cc. Let's say 1 cc. So I put 1 cc of air. Okay.
So hold the body of the uncapped syringe in the right hand and the bottle neck of the bottle in the left index and thumb. Touch the right index fingertip to the left palm base.
Okay, so hold on. So right index thumb is the syringe, okay. Left index thumb is the bottle, okay.
This allows for fine control of the needle insertion using wrist and hand muscles rather than poorly controlled bicep and pectoral muscles.
Okay, so basically what I'm doing is you see that my fingers are touching my palm. So my right fingers, the dorsal part of my right fingers are touching the ulnar aspect of my left palm. And now, instead of putting the thing here and pushing in an uncontrolled way where if I miss I can go, I'm just using very fine motions of my wrist or these muscles here in my hand to make the insertion happen. Okay?
So with very small displacement of the left wrist, that is the vial, make the needle pierce the rubber stopper of the vial, keeping the right hand still.
Great. So some people push the right hand in. I prefer to keep the needle still and push the rubber stopper over the needle. Okay?
So inject the air into the vial.
Okay, so now I can inject the air into the vial, and now I'm creating a little bit of pressure inside the vial so that when I suck out the 1 cc of liquid, I've already put 1 cc of air, so there's kind of an equal volume in there. Otherwise, you're going to leave kind of a vacuum inside the bottle, and it's going to be harder to draw out the material. Okay?
Okay, so draw back the desired amount of the solution. Make sure the needle tip is in the solution.
Yeah, you see that? There's a lot of solution in here, but you can imagine a situation, and I'll do that with this other material here, okay? You can imagine that the needle here is out of solution. Of course, do you see that? Yes?
Yes.
Okay, so then I'm not going to be drawing back anything, okay? So I have to withdraw the needle down into the solution, and now, of course, I'll be drawing back whatever I need to draw back. Okay? I'm just going to waste that. Okay?
So remove the needle from the solution and place the solution bottle onto a countertop. Avoid putting solution bottles on the Mayo stand.
Okay, so of course here we're just working with the bottles, but when you're dealing with a actual patient setup, and we can come over here, all of this kind of drawing up the solution stuff should be happening over here. And then when I'm done with, let me just grab some solution here. So I got some solution, I took it out. When I'm done with this, first of all, I put the safety mechanism, and I put this back on the tray. Okay, it's never a situation where I have these stock bottles on the tray, because there's going to be blood in this field, and then the blood is going to touch these things, and then I can introduce blood into here, and that's how people get hepatitis from the doctor's office. Okay?
Okay, so when drawing up a mixture of water with triamcinolone, diluting, say, 40 milligrams per cc triamcinolone, down to 20 milligrams per cc of triamcinolone.
I filmed this video 8 years ago and realized after much thought that we screwed up the order of which to draw up first, the medicine versus the saline. And I also did the whole video without gloves because I knew I wasn't going to be using dealing with an actual patient, but by right we should always be using gloves. Whenever you draw up medication, you want to make sure that you look at the expiration date of the vial and make sure that it's not expired. You also want to make sure that you verify that it's actually the drug that you're intending, that you don't accidentally take a vial of methotrexate and draw up some volume of that instead of triamcinolone. So you always kind of like, you say, what am I drawing up? Is it good? Is the date good? Then you draw it up. And then if you want to be a little OCD, which is okay, you say, okay, just to check, what did I draw up? Okay, great. And that's kind of like how you make sure you don't have an error. This bottle is sterile, and if I took this out of the cabinet, this top would be dirty, in which case, of course, I want to clean off all the bacteria with an alcohol swab It doesn't sterilize the top, but it keeps it quite clean before I, plunge a needle and plunge whatever stuff is on top of this cap back into this vial. My philosophy is that the top of this cap is never cleaner than just out of the factory. And so after I flip the top, it flips, okay? Nothing has touched this yet. So I can only make it more dirty by like taking a alcohol swab and rubbing it right after I open it. So I am very comfortable inserting the needle into a freshly opened cap without wiping it with alcohol. Let's say I start with a stock bottle of Kenalog 40. And oftentimes I like to dilute this stock bottle to get like Kenalog 20, okay? That means that I'd have to take, for example, if I wanted 1 cc of Kenalog 20, I'd take a half a cc of the 40 and half a cc of the water, and I could get 1 cc of Kenalog 20. I have 2 bottles. If I take medicine from bottle A first and then impregnate bottle B, I'm going to contaminate bottle B with medicine A. But the same is going to be vice versa. If I start with medicine B and then impregnate medicine A, there's going to be some B that contaminates A's stock bottle. So since both are going to get contaminated regardless of the direction, the water is cheapest and the medication is generally very much more expensive. So you take the medication first and then you try your best not to contaminate the water with the medication. And if it happens that you get significant reflux of medication in the water, then you discard the water bottle. Generally, what we do is, if I'm working with Kenalog 40 and always diluting that, I will designate this bottle to only be used with Kenalog 40. So I won't dilute Kenalog 40 in one instance and use the same bottle of water to dilute 5-fluorouracil or something. No, that I'm just going to use this bottle of water with diluting Kenalog 40. So if you have a little tiny drop of Kenalog 40 in this vast sea of water, nothing's going to happen if I use this same water, slightly contaminated, with another aliquot of Kenalog 40. So what I would do, you'll notice that there is sediment here in this, and so if you shake the vial, there is no sediment. You see that? No sediment. Here, I didn't shake the vial. There is sediment, and you're going to mess up the concentrations of things before and after if you don't shake. So this doesn't have all of this material in this liquid. So I'm going to draw this up. If it's inadequately shaken, I'm going to draw this up, and I'm going to think I have 10 milligram per cc, but really I have 5 milligram per cc. Now I've taken out all this pure water, and now the next time I shake it and draw it up, okay, I think I have 10 milligram per cc, but really I have 20 milligrams per cc because I've taken out pure water, and now it's more concentrated. So obviously, for the sake of the current patient and the next patient, you want to make sure that you've shaken it properly. So you have to shake. Some people shake with their elbow. I like to have a very relaxed wrist. And, now you have no... Oh, do you still have sediment there? You got to be sure. Sometimes it takes a few shakes. Now there's no sediment. Okay, so now what I do is, again, uncapping the syringe. I make my hands like this. I take the needle off, and then I have my hand out of the way, and I lift the thing off. Okay, fine. I always like to put the vial to the needle. So I insert the amount of air that, or even a little more than the volume I want to get out. So I want a half a cc of this stuff in this vial. So I'm going to put a half a cc of air. I'm going to attach the syringe to my hypothenar, and I'm going to put the stopper towards the sharp. Rather than putting the sharp towards the stopper towards the stopper is more safe. I'm going to put the air in, and you'll notice here that the needle is above the liquid. So if I start pulling, I'm not going to get any liquid out. So what I need to do is make sure that the bevel of the needle is submerged in the solution, and now I can start drawing out. And what happens is, as I start drawing out more solution, eventually the bevel starts to show again, and then I have to so I always am basically as I'm withdrawing the plunger downward, I also am slowly withdrawing the vial upward, so I constantly am keeping the tip of this needle submerged. So it's like, so I have it up submerged, and I pull it out, and as I'm pulling this plunger down, I'm kind of, in an exaggerated way, I'm pulling this up until such time as, you'd come out. So if you're finishing the very last drop of the bottle, that's how you can get the very last drop out, is putting a vacuum with this plunger as you just withdraw that. Notwithstanding, here I've taken out too much liquid, and so before anything settles in my syringe, I am just going to squirt some back, and I have exactly the amount I need. All right, now I'm going to go to the bacteriostatic solution, and again, attached to my hand. Here I'm going to put lateral pressure on the syringe, because otherwise there will be a vacuum here that will suck up the syringe and spill all of this medicine into this vial. I want to prevent that from happening, so I'm going to force at an orthogonal perpendicular angle that way the plunger. So now the plunger can't move. Okay, plunger's fixed. I put this, and again, rather than stabbing my thumb, I am my fingers are at the top of the bottle. My fingers will never touch the needle if I keep it this way. I put it in, and now I very carefully withdraw, and the same deal. If I had to, I can pull that up, and then I can kind of pull that off. And now I have in this syringe, I have the 1 cc of 20 milligram per cc. You can recap. When I recap, I like to just drop it and then pull it down, so I'm never poking myself. I like to pull some air into this and allow mixing by letting the air go in and out like that. So you don't have to do like a vigorous shake with the needle. It's sufficient just to do this and that. Now I should recap the needle, and you're allowed to recap the needle when it's sterile. Okay, go ahead.
Once the needle is capped, remove the large bore needle if necessary, and attach a smaller bore needle. So
what I do here is I want to suck out any remaining liquid in the large bore needle. Okay, great. I remove this, and if I'm going to be injecting a lesion, I want to get a 30 gauge needle. So I'm going to attach that. And now technically I should keep this on top, and I'm going to get the air out now. And I'm just going to get the air out here, okay? And so now, right, you can see just there, I'm just where I need to be, okay?
Okay. So if, say, a 25 gauge needle was used to draw up the medication, that same needle can be used to deliver an intramuscular and some types of intralesional injections. Next, place the capped needle with syringe onto the Mayo stand.
Now I will say that if you let this vial sit for like an hour, or quite frankly even 5 minutes, you end up getting solution precipitating out of you end up getting solute precipitating out of the suspension, and so what happens is if a couple of different scenarios here, if I leave this down and I go do something else, all the solute will precipitate out of this, and like if it's at a slight angle here, for example, all the solute will precipitate by the plunger base, and when I go to inject, I'll be injecting water, and then all of a sudden TAC 40 instead of TAC 20 uniformly throughout. And quite frankly, if I take too long to inject, and the person says ow, and you're not sure where to go, and this is sitting in your hand and you're taking like 5 minutes to inject. As you're injecting, stuff is precipitating out, and so periodically you have to be like, oh, I see that it's precipitating out, let me withdraw some air, remix it, and then push it back, and then continue to inject.